Welcome back to the Morning Blend. Foot and ankle pain can happen for lots of reasons. I know because I have it chronically. It can be from an injury, disease, or just bad genes. We are live now at the brand new Greenfield office of Advanced Foot and Ankle of Wisconsin with Dr. Timothy Henke. He is going to take us on a tour of their new facility before we chat with Dr. Patel with new technology for relief, which is great. Good morning to you.
Good morning. Good to be here with you. So I'm here at our newest location on Loomis. So I'll give you a quick tour of the office and show you some of the interesting new technology we have too. So this is our waiting area, and we have a nice big exam room down this way. This is an area for MRI that we have. That's not here yet, but that'll be coming in the next couple months. So we have the ability to do x-rays, MRI, all that imaging right here on site. So these are our exam rooms. We have 5 exam rooms.
Oh, wow. You have a lot of room there.
Yeah, a lot more room than we used to have, too. And we have a nice big exam room for any procedures that we need to do in the office to make patients feel comfortable. Nice spacious area so they don't feel closed in.
That's fantastic. So you can actually do some of your procedures right in office there.
Yep, there's a lot of things we can do in the office, minimally invasive procedures and taking care of ingrown toenails and things like that so that people don't have to go to a surgery center or go under anesthesia. So it's really convenient to be able to take care of those things quick and easy for patients.
Yeah, and what's in there? What type of room is that?
So this is actually our x-ray room. So we have the ability to take digital x-rays here. It's nice because we don't have to wait for films to be developed. They come up almost instantly, and we can take a peek at x-rays and diagnose things quickly that way too.
Wow, because so much it seems is involved in the waiting for those results and x-rays to come back so you can make decisions. Tell us just real quick about the location, because you're on Loomis Road, right? Is it just off of I-894?
Yep, yeah, we're right off of 894-43, so we're right on Loomis, just taking that Loomis exit and coming down a couple blocks. It's very convenient. We're pretty close to 94 too, so it's a nice central location for everybody in Milwaukee.
What about parking as well as your office for people who have disabilities?
Yep, plenty of handicap spots out in the parking lot. Very large parking lot too. It never fills up, so there's always plenty of parking for patients here too.
That is wonderful. I want to also welcome Dr. Patel, because one of the things we teased is some of the great revolutionary advancements that you have there in your office, which is great. Good morning to you. Great to see you, Doctor.
Morning, Morning, Molly. So I'm going to show you some stuff we're really excited about. We're implementing cutting-edge technology in this new clinic. So let's start with this 3D orthotic scanner that we have. So we're going to have our model kind of come in here, and a lot of times we used to do orthotics with casting or putting pressure down, but now there's newer technology and it's way better for the patient, and it gives me more tools to make them a better custom orthotic or a custom insert. So we have a 3D scanner that will scan the bottom of the foot, and once it scans the bottom of the foot, it gives me some information as to what kind of deformity I need to correct with the orthotics. And then we also have, this is a pressure mat right here, and you're going to see Marcy step on here. Go ahead.
Okay.
And when she steps on here, you can actually look at the computer there, and that gives us a live image of how much pressure she's taking at her heel, on the front part of her foot. And that gives me very valuable information as to how to make a perfect orthotic for her, whether she's someone who's an athlete or someone who has arthritis, etc. So this is cutting edge stuff that we're just starting to implement. And then I always like to show a finished product. So this is what the orthotic looks like. So not only is the scanning technology 3D, the orthotic is actually 3D printed as well.
Wow. I can't believe how
Yeah.
quick you can see things like that and get an image that's so helpful to you.
Yeah, this is live. It's live. It's transmitting the pressure she's putting on that mat directly to our computer, and then her orthotics are made off of that. And then she'll, in a couple of weeks, this will come back for her once it's 3D printed, and it'll go inside her shoes. And that's the way, we're speeding things up and kind of allowing better correction of the deformities with this newer technology.
That is incredible. Tell us about the siren sock, because this is something that we teased earlier. How does it work?
Yeah. So I'm going to show you here. So this is just a sample pair of the sock I took out for you guys to see. So these are socks that we dispense to our patients who we deem are high risk. Perfect example being a diabetic patient. So they'll get these, and all they have to do is treat them like normal socks. You can wash them, etc. They plug in a little module into the wall, and then that gives us a bunch of information that we can monitor remotely about the temperature of their foot and any other infection indicators that might be concerning, so we can have them maybe follow up before their actual appointment is and kind of keep the risk really low for them.
So this siren sock, is this something that's someone who's diabetic, they're the ones who this is helpful for in monitoring, and then can it lead to some type of compression stocking, or how do you use it to treat the problem?
Absolutely. So, you know, this year especially, we've heard the word telehealth over and over again, and as we've started to, as healthcare providers, implement that in our practice with the pandemic going on. So this would be the perfect technology to go hand in hand with that. So let's say a patient alerts on their sock that their temperature on one foot is higher than the other. I'm concerned about that because that might be an infection. So I can schedule a telehealth visit if they would like, or in person, and then we can come in and see what the problem is. Whereas if they waited, let's say, 2 or 3 weeks to come in, it might be too late and we have to intervene surgically. Whereas if they had this and it alerts me earlier, we might not have to do that.
So many incredible advancements. It was wonderful to have a tour of your new office today. Thank you both so much for showing us around.
Absolutely.
Incredible advancements, and the name is Advanced Foot and Ankle of Wisconsin. They have locations all over the area to help you. Today we're at the Loomis Road location just off I-894. You can call this number to schedule an appointment or find out more. It's 414-281-1500. You can also go online to advancedfootanklewi.com.